tutorial, I'll go over some of the examples of congenital heart defects. Just to recap, congenital heart defects are heart defects that are present from the time of birth. And there's two main categories. There's cyanotic defects and acyanotic defects. The difference is that cyanotic defects tend to involve cyanosis, bluish discoloration of the skin, because you're hypoxic, your percent oxygen saturation is reduced. In other words, you're not getting sufficient oxygenated blood to your body. Acyanotic means you're not cyanotic, there's no cyanosis, and so there's no blue discoloration, your percent oxygen saturation is normal, your body does not receive any deoxyhemoglobin, everything is normal in terms of oxygen saturation in acyanotic, but there's still a problem with the heart. And so we'll see some examples of both cyanotic and acyanotic. At the level of the heart, acyanotic defects tend to primarily involve left to right shunts. In other words, blood is going from the left side of the heart to the right side. And the reason for that is because you can see that the left side of the heart pumps not only to the body but also to the right side of the heart. In other words, you get oxygenated blood going to your body and to the right side. So there's no deoxygenated blood going to the body. And for that reason, your blood is fully oxygenated when it goes out to the body, so it stays. So there's no cyanosis. So acyanotic level defect involves a left to right shunt. Cyanotic defects, on the other hand, involve right to left shunts, the opposite direction. Right to left shunts, you can see that you can have this again at the level of the atrium or the level of the ventricle. And cyanotic defects, these right to left shunts, the reason it's cyanotic is because the oxygenated blood from the right side gets to the left side, and then the left side pumps that deoxygenated blood together with the oxygenated blood to the body. So you have mixed blood going to the rest of the body, and that mixed blood has a low oxygen saturation than normal, and so you become cyanotic. So here are two examples of left to right shunts. You have an ASD, which is a hole in the interatrial septum, in the septum that separates the right and left atrium, or you can have a VSD, where the hole is here in the interventricular septum. So I'll begin with an ASD. So basically, there's different types of ASDs. You can have patent foramen ovale or patent foramen ovale. In other words, your foramen ovale does not close when you're born. Normally it should close. Not only that, also your ductus arteriosus and ductus venosus, they all have to close. But if they don't close, you use the word patent in front of the word. So patent foramen ovale means an abnormally open patent foramen ovale. Patent ductus arteriosus right here means that ductus arteriosus did not close and stayed open. Okay, so you have a patent foramen ovale, that's one example of ASD. Another example is a secundum defect, which is also found in this area of the foramen ovale. Another one is a sinus venosus defect, which is up here close to the superior vena cava. And the last one is a primum defect. Primum defect is down here close to your tricuspid valve, and also this is where your AV node is. So it's pretty risky to surgically repair the primum defect because you might injure the AV node and therefore require pacemaker. So those are your ASDs, patent foramen ovale, sinus venosus, secundum, and primum defect. Each one of those defects is also associated with other defects. For example, your secundum defect is associated with pulmonary stenosis, sinus venosus associated with pulmonary veins draining into the right ventricle, into the right atrium, I mean. And you have a primum defect associated with a mitral valve cleft. Okay, so that's your ASD. There's also different types of VSDs. There's muscular VSD, where the hole is in the muscular portion of the interventricular septum. You can have paramembranous VSD, which is up here in the membranous portion of the septum and is continuous with one of the leaflets of the tricuspid valve. There's also a coronal septal defect, which is continuous with the infundibulum that separates the pulmonary artery from the aorta. And there is AV canal defect. AV canal defect is also around this area, continuous with the tricuspid valve. And AV canal defects tend to be associated with a primum defect, but not vice versa. Okay, so you have different types of VSDs, muscular, there is paramembranous, coronal septal, and AV canal defect. Now the reason these are acyanotic congenital heart defects is because you have a left to right shunt, and that is because the pressure on the left side of the heart is normally greater than the right side of the heart, and depending where the hole is, if you have a hole up here, ASD, you get blood going from the left atrium to the right atrium, or if it's at the level of the ventricles, VSD, it's going to go from the left ventricle to the right ventricle, a left to right shunt. So the last type of left to right shunt I will talk about is called AVSD, atrioventricular septal defect, also known as common AV canal defect. And basically what you have here is you have an ASD, a primum defect, you have a VSD, which is right here in the upper intraventricular septum, and you have a single common AV valve. Okay, so you do not have two AV valves, you have just a single common AV valve. So there's three defects in one. There's an ASD, VSD, and a single valve. And for that reason, you can see that there's a strong left to right shunt. And not only do you have a ASD, left to right shunt occurring at the level of the atria, there's also a left to right shunt at the level of the ventricles, and there's also regurgitation of blood from the ventricles to the atria. So there's very large amount of left to right shunt in AVSD. And for that reason, it should be corrected as soon as possible, within 6 months after birth, because it's very dangerous. And to correct it, you would have to separate the single valve into two by closing the cleft, and you would have to put a patch here, ASD patch and a VSD patch, and that will hopefully correct the problem. So those are the three left to right shunts: AVSD, you had the ASD somewhere there, and you had the VSD. And next tutorial I'll talk about the cyanotic or right to left shunts.